Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton. We're going through a series of videos on metabolic and thyroid function and why you may be experiencing symptoms even if your lab tests are normal, even if you're on medication, whether you're not on medication, just basically the whole process of what can be going on with the thyroid gland. Now, one of the reasons I'm talking about the thyroid gland is because it encompasses so many different aspects of the body. That's why this video series is going to be so many short videos, because there's so much information that's involved in the thyroid metabolism. Okay, so we talked about the brain on the last video. Again, if you have not watched the previous videos, please go back and watch them in the correct order, because this is very, very important information. Now, the brain needs to be sending the proper signal to the body. Okay, we've addressed that. Now, let's say that we get to this point and T4 gets onto thyroid binding globulin and gets out to the liver. What is the function of the liver? Well, the liver function is used to detoxify the blood. And when the liver detoxifies the blood, so we have our liver, forgive my artwork here, we have our liver, it detoxifies the blood and it forms bile. Bile is then stored in the gallbladder. Now, the liver also not only detoxifies the blood, the liver is also responsible for fat metabolism. So if you have a decreased liver function, you're going to have decreased fat metabolism. The liver is also responsible for blood sugar regulation. So if your blood sugar drops low, the liver has stores of what's called glucagon, which it mobilizes, which can turn quickly into glucose and help maintain normal blood sugar. So the liver has a lot of functions. So if you have a decrease in liver function, you're going to have issues throughout the body. And a lot of patients that we see, because there's such a toxic environment that we live in our foods and in our, if you take medications and in the clothes that there's so many toxins that we're exposed to in our environment, the liver is constantly being worked. So a lot of patients have liver imbalances, okay? So if you have a liver imbalance, you could end up having different issues with gallbladder issues, with detoxification, with blood sugar regulation, but you're also gonna have issues with thyroid conversion, because the liver sits right there. So not only would you be having liver issues, you're gonna have decreased conversion of T4 to T3. How do you know if you have a liver issue? We use a lot of different processes in our office. We use questionnaires, we use lab tests, we use all kinds of different aspects to figure out how is your liver functioning and what's going on with this. Now, it's important to understand that we're not talking liver disease, okay? You can not have liver disease, cirrhosis, you cannot have fatty liver, you can have malfunction without it being a disease process. So that's an important factor to understand. Just because you haven't been diagnosed with a liver problem doesn't mean that you have decreased function. In fact, in the next video, we're going to talk about lab values so that you can understand how that happens, okay? So this is, liver is the first thing that we need to look at, and again, we look at it through questionnaires, through lab values, to figure out what's going on with the body and to figure out how your body is metabolizing everything. All right, we'll see you on the next video.